Hi, everyone. I'm Ali Diab. I'm one of the co-founders and CEO of Collective Health. Thank you for joining us today for this webinar where we're going to discuss AI, its applications in healthcare, and how we specifically at Collective Health are applying AI and using it to better our members and clients' health benefit plan experience. Before we jump into the content, I'm going to introduce a couple of my colleagues, Kimmy Mitchell and Rohan Rangel. Maybe Kimmy, I'll popcorn to you to do a quick intro on you. You've been here a long time in a lot of different roles, so I'm sure people will be interested in that.
Hi, everybody. I'm on our product team. You always comment. I've been at Collective for about 10 and a half years now, so seen a lot of growth at Collective Health and have been really excited to be part of the AI evolution at our company and excited to talk to you about what we have for your members and future customers. I'll pass it off to you, Rohan.
Thanks, Kimmy. Hey, everyone. My name is Rohan Rangel. I'm the Vice President of Product here at Collective Health. I haven't been around as long as Kimmy and Ali have been. I joined Collective Health at the end of last year, but I'm super excited about the mission, our culture, and what we're doing with our products. So I'm excited to talk to you about those today. Ali, back to you.
Thanks, Rohan. So before we get into AI and its applications, we thought we'd just step up a level and give you all an overview of what we do at Collective Health, and I'll maybe provide some context in terms of why we do things the way that we do them. So under the hood, we are a third-party administrator. We administer health benefit plans on behalf of self-insured employers almost exclusively. That being said, we have other capabilities and applications, if you will, that we've built on top of that third-party administrative platform, including member experiences like native apps, as well as web portals for our members to access their care, their benefits, cards, information related to those plans. We've also built a very interesting, we think, and configurable and flexible ecosystem of about 200 different integrations and partners. They span everything from classic PPO networks to centers of excellence, direct contracts, as well as a very large, over 150 member ecosystem of point solutions and virtual first options for people to navigate care. And then last but not least, we have a client portal, which we call Compass, that includes a bunch of administrative features for our clients and their broker and benefit partners, consultant partners, as well as analytics and reporting built in. And this is an area of increasing focus for us as we knit together a lot of different configurations for our health benefit plan client customers, and they want to understand what's working and what's not in order to optimize those decisions. So that's sort of in a nutshell what we do. What I would say at the end of the day, all of this is in service of enabling employers as well as the workers and families on our platform to make better decisions about healthcare. We think they are not necessarily as informed as they need to be, and as a result, don't necessarily make the optimal decision. This is just a snapshot of our sort of results and metrics to date. They're actually a little bit out of date. We have about 860,000 members now on our platform across the US, one of the largest independent TPAs in the country, if not to say the world. And we've processed a very significant number of medical claims to date. We're a pretty large scale system now. If we were a risk-bearing insurer, we'd be a multi-billion-dollar insurer, but we don't do that for intentional reasons, which we can get into as well later. So to that point, I'd say what makes us unique in the ecosystem are these sort of pillars. At the end of the day, we exist to serve and fiduciarily perform the function of managing self-insured employer health benefit plans. That means we don't seek to make money from the cost of care or any of the options that your members use, your workers may use, or their families may use. And we try as much as we can to maintain our independence in enabling our employer customers and client sponsors to be able to decide what they want to do with their own interest in mind. I'd say maybe going to the right, going clockwise, we were founded based on a very personal experience that I had having my hospital stay and health benefit coverage denied. And so that's always and will continue to be our North Star. We're here to help people navigate a very complex, fragmented system, enable them to make decisions that are both clinically optimal as well as financially optimal, and both for themselves as well as for their employer sponsors. And related to that, we believe that transparency is the substrate that should underpin all of that. You should know why you're making a decision, both clinically and financially, and we shouldn't hide anything, nor should anyone else hide anything in terms of why you're spending what you're spending, where that money is going toward, including all fees like rebates, et cetera, that may be part of your health benefit plan. And then last, but certainly not least, related to the independence point that I made earlier, you really should be in control. Our job is to enable you to make whatever decision makes the most sense, both as an individual when it comes to your health, without any skin in the game, so to speak, and as a client sponsor, enable you to mix and match and configure your health benefit plan in whatever way makes the most sense for your population. As a technologist myself by background, having worked in consumer tech for most of my career prior to Collective Health, I definitely felt like a tech first, if not to say tech forward experience was missing when I went through my own journey 13 years ago, trying to understand why my health benefits were denied. And so we have definitely taken that approach from the very beginning. That being said, we don't view tech for tech's sake as a be all and end all. It's a means to an end. And where it makes sense to employ technology, we do. Where it makes sense to have people get involved, we also involve them. And I think it's important as we start to talk about AI and its implications, because there are facets of AI that are decidedly very tech, and there are facets to AI that are actually decidedly very human or human-like. And part of the needle that we're trying to thread is how to use these technologies in a way that preserves the humanity and the care in the experience while leveraging the things that make technology so powerful. For example, being able to do very large-scale things very quickly, being able to retrieve information very sophisticatedly in a very easy-to-digest manner in a way that might take a human being, hours, if not to say days, if not longer, to try to curate and bring to our members. And so we're really trying to balance that sort of power of technology and data that underpins it with a very, very simple, easy to understand, user-friendly experience on the front end. And again, using technology where it makes sense to, and using humans where it makes sense to. Which leads me to my next slide, or our next slide, which is, we have people at Collective Health, many of them, who spend a lot of time on the phone, over email, on chat, and messaging with our members, helping them navigate, as I said earlier, a very, very sometimes clumsy and very convoluted healthcare system. They're available 6 days a week. They speak a myriad of languages. We have our user experience also translated natively into Spanish, not like a Google Translate, but like a proper translation into Spanish. And as a result, as it says in the bottom right of this slide, we influence our members' care pretty significantly. Almost 2/3 of all the dollars that are spent in health benefit plans that we administer are preceded by an interaction related to that spending by one of our members. So we feel like the level of engagement that we provide is pretty exceptional. And again, it's not something that we try to drive in and of itself. This is not Instagram or Facebook where we're trying to get people to scroll for scrolling's sake. This is because we know that people don't necessarily have all the information to make the best decision in any given moment. And we feel it's our duty to provide them that information and to help navigate them in as transparent and objective a way as possible. So I'm going to talk a little bit about AI at a high level, and then, have, Kimmy and Rohan also provide some perspective from their end after. So late last year, we introduced CAI, which stands for Collective AI. And it's not just a chatbot. It's actually our entire platform-wide AI intelligence layer. We're working with Google. We believe Google has a set of capabilities and a framework that prioritize safety and reliability in ways that other options that we evaluated didn't. And we are deploying AI, I'd say, in a measured, research-driven and data-driven way, empirically driven way, across various facets of our systems, both back office, if you will, and front office, through experimentation and the evaluation of those experiments and making sure that the level of safety that we deliver to our members and to our clients using these next generation AI capabilities meets our standards. And we have a set of core principles that underpin, which I'll get into, what our standards are. So again, there's a platform-wide intelligence layer that underpins everything, and then a bunch of AI platform applications, if you will, that sit on top of it that relate to how we interact with our members, how we monitor our own systems, and then how we provide service to our client customers. And as I said, our core principles really drive everything that we do in AI. I'll read them because I do think they're important to emphasize. So first and foremost, AI must always enhance the customer experience. It can't diminish it. I think we've all been on those kind of chatbot experiences or call center lines where you're just like, can I please speak with a human being because you don't get what I'm trying to say? We have an even higher standard than that. Our AIs need to be able to do something as well, if not better, than a human, or else we won't deploy it. And related to that, it needs to be as accurate as a human, and ideally a whole lot more. And that's a standard we absolutely hold ourselves to. This is something that I think is talked about quite generally, but really, really matters when it comes to the delivery of health benefits and health benefit service, and that is AI can do no harm. It can do no harm to our customers, to our workers, and to society more generally. It's really important that we deploy these systems with safety at the very forefront of our mind. And then last, but certainly not least, and related a little bit to the second principle, AI can never be catastrophically wrong. And it has to respect the boundaries of human interaction. We're not okay with AIs that hallucinate. We're not okay with AIs that tell you erroneous things. We're not okay with AIs that might lead you to do something that could injure yourself or a loved one. And so the standards, especially in healthcare, have to be extremely high. So I want to talk a little bit about our collaboration with Google and why we chose to work with Google. I touched on it a little bit earlier. As I said earlier, Google has exemplified to us a commitment to safety that we think is really unique in the industry. People may not know this, were actually the original authors of the Transformer paper that actually underpins all modern large language models. So you could almost say that the modern AI movement actually was precipitated and generated at Google. They have a set of rubrics and tools that allow us to deploy technology across our entire technology system, both from a user experience standpoint, think very sophisticated chatbots, voice software agents that might be able to answer very sophisticated, complex questions or perform tasks on your behalf that you might not think that they can do, but they actually do. But also at the underlying data layer, Google's experience in search and integration of all sorts of different kinds of data, geospatial data, textual data, visual data, video data. Just think about all the different properties that Google has, from YouTube to Google Maps, etc. Also gives them, in our opinion, an advantage in the building of foundational models that's very useful when it comes to providing service and being able to analyze healthcare information at very large scale. And then certainly last but not least, they have a massive infrastructure, whether it's data centers or data ingestion and cleansing systems that we're able to leverage, that again in healthcare, coupled with their commitment to safety, really makes them uniquely positioned, in our opinion, as a strategic foundational model partner for us to work with.
Thanks, Ali. With that, I'm going to hand it to you, Rohan, to talk us through a couple of product demos and explicitly how we're implementing Kai at Collective Health.
Sounds good. Thanks, Ali and Kimmy. So on the first slide, you'll see here Kai CX. It refers to our client experience work within Collective Compass. It's really the employer portal that we have for benefit leaders, plan administrators, and their consultant partners. What we're working on currently is how Kai CX can simplify, typically, I'd say laborious, often painful experiences that HR teams have, accepted as status quo. So tasks like implementation or annual enrollment, seasonal HR responsibilities. And this Kai CX preview is for our annual enrollment tool that'll be embedded directly into Collective Compass, which again is our employer portal. Within Collective Compass, the annual enrollment tool will help solve the need to do a few things. One is centralize a complex and error-prone. Oftentimes we see spreadsheets and documentation-heavy workflows. Centralize that into a singular user experience. The next would be surface historical plan design and collect critical plan design changes earlier to productively manage re-enrollment. The next would be allow for user collaboration on plan design changes and sign off between HR leaders and their consultant partners. And the last is really make visible the dependencies of the process so we can highlight when things may be at risk well ahead of time. And as we look to the future, we're also building out, I would say, how Kai CX helps provide actionable insights based on claim analytics for HR teams and their consultants. So as Ali spoke about earlier, our member experience is really high tech and it's high touch. And our goal with AI isn't necessarily to replace humans, but instead to help our internal teams supercharge their abilities. How can AI essentially become an extension of humans? And a big body of work for us in the last year has been improving the documentation system for our member advocates. These are our dedicated team members that help address members' needs when members are calling in on the phone. So on the next slide, you'll see a video demo where our Kai intelligence layer is, again, to use that term, supercharging our member advocate capabilities by reducing their need to multitask through automating documentation and ultimately surfacing the right information at the right time. So we're going to play a quick demo video for you here. You'll see our interface for our member advocates when they are speaking with members on the phone or chatting with them on the phone. On the right side panel, you'll see our member 360 dashboard that brings together relevant data that we have access to as a TPA, things like prior auth statuses and recent member contacts that member advocates may find useful to have at their fingertips and for a full picture of what's going on with the member. And so as this call is getting started, you'll see Kai Intelligence in action. Essentially, it's transcribing the call in real time so member advocates can actively listen to the member without documenting every important detail. And for this example, the member first asks for coverage for her annual physical visit. And the member advocate quickly flips to our Knowledge Assist tab, where Kai has surfaced plan-specific answers to the member's questions, along with directions on how to coach the member on how to find an in-network provider within My Collective, which is our member portal. And then next, the member shares that her husband has recently lost his job, asked for information on the COBRA notice they received in the mail, and Kai provides accurate and concise educational information to support explaining a lot of those confusing healthcare nuances to members. And all of this is really without having to go on hold to search for the answer. I think we can probably go to the next slide if folks get an idea. Yeah. So I'll shift gears a little bit to talking about Kai MX, which is within our member experience. Kai, which is our agentic AI chatbot, helps our members better understand, navigate, and pay for their healthcare. We were very intentional with how we rolled this out by starting with capabilities that specifically address, I'd say, the most common questions at the beginning of the plan year. So questions like, where's my ID card? Send me a new one. Why is my claim denied? Have I met my deductible? Can you help me find a provider? We really wanted to start with these specific flows to make our models smarter while also meeting members where they are at the beginning of the new plan year. We want to essentially encourage self-service to get members easy answers in the quickest manner. So as we continue to make our agentic AI capabilities more sophisticated across the board within My Collective, we have another demo that shows how Kai will help to take work off of a member's plate and take appropriate action on their behalf in My Collective. And specifically, the work looks to do three things. Number one is encourage self-service through our digital offering to get quick and easy answers immediately. And it does that by pulling the information needed right into the chat without needing to search for it. Number two is comprehensively answering and anticipating a member's needs beyond the initial question, because frankly, we know what the follow-up questions should be. And number three is knowing and elevating a member's plan by knowing the nuances inside and out so members can actually understand and use all the benefits available to them without having to be a benefit expert. And that's our job. So in the next set of slides, Kimmy, you can start to click through and I'll kind of voice over what you're seeing. So we put together this demo inspired by the experience of one of our members, a mom whose son has been newly diagnosed with autism. And Kai is able to interpret and answer questions in the member's own words to direct the mom to the best care on her specific plan. So Kai reads client-specific plan data to surface the right information from their plan, including covered point solutions, preferred providers, in-network options, all with the upfront and transparent cost information, and pair that with the ability to reference claims history context to provide a really highly personal experience. And the member gets the right information at the right time, all appropriately covered within their plan. This enables members to make healthcare decisions like they do for any other service they might consume, even outside of healthcare. And in this context, it's without a surprise bill. Eventually, Kai will be able to take appropriate action for members as well. Okay, I think next slide. That was it. We hope you enjoyed the Collective AI presentation. If you're interested in learning more about Collective Health, I'd highly suggest selecting the QR code to request a demo. I also encourage you to listen to our Benefits Playbook podcast to learn more about important topics impacting healthcare, just like we talked about today, and AI. And this is with the best and brightest minds in our field. And with that, I think I'll turn it back to Kimmy for some Q&A.
All right, everybody. Thank you, Ollie. Thank you, Rohan, for walking us through that. Just a reminder to all of our attendees to use the Q&A function to submit some questions. I can see what we have here to get us started. All right, I see a couple of questions in here. For both of you, I'm also happy to chime in on this one. What is the most significant measurable outcome you expect from empowering member advocates with Kai Intelligence?
I can start. Yeah, for sure. I can start. I don't think, from my perspective, I don't think the things that we're trying to drive necessarily change. They just, I think, can be improved significantly or accelerated with AI. So to me, the measurable outcomes that we currently look at, which are people making the optimal healthcare decision given their circumstances? Are they satisfied with the experience that they have? It's also very important. And are we doing things in as efficient a manner as possible from their perspective? Meaning, are we wasting their time as little as possible to get to that objective? Will continue to be the things that we focus on and look to drive, whether it's using these generative AI capabilities or not. So I don't think that AI necessarily changes what we're trying to do, because those are the right objectives. It just presents an opportunity, I believe, to allow us to achieve those objectives more quickly at a larger scale sooner than we could without it. Rohan, I'm curious what you might think as well.
Yeah, I mean, I think you're absolutely correct. I would say it makes me think about sometimes, when you're on a customer service call and at the end of it, you usually get a survey to some extent to say, like, how has this service and how's this experience been? I'd love to figure out how we attach outcomes to, right, giving our member advocates the ability to excel at providing that customer service. And so to me, it feels like, can we measure, to the points you made, how effortless it is for people to ultimately understand, to navigate, and then pay for their healthcare? If there are outcomes that we can attach to that and measure, that would be how I kind of think about it. What about you, Kimmy? Anything you'd like to add?
Yeah, I think for us, it is getting much more nuanced in how we define resolution and meeting our customers' needs. There's a difference between, getting somebody off the phone as quickly as possible. There's also a difference between answering the question that is tossed over to us versus truly understanding the complexity of healthcare and what are the likely next steps and pitfalls and hoops you have to jump through when navigating the system. And I believe AI makes solving that much more equitable for all of our member advocates. No longer do you need a deep background in this space. We as a company have been in this space for so long that we really want to empower any member advocate, regardless of tenure, to be able to provide that excellent experience for our customers. So ensuring that kind of experience consistently across the market as well as we grow is something I'm very excited about. Okay, next question I have here for you, Ollie. If you could solve one data interoperability or regulatory issue today to unblock AI's full potential, what would it be?
I mean, I'm not sure that I would focus on, to be honest, things that unblock AI's potential, because to me, if we, for example, solve the price transparency problem, that unblocks not just what AI can do, but what humans can do as well. So I would say if I was going to focus on something related to interoperability or regulatory, I would focus on ensuring that pricing in our healthcare system, in the private part of the healthcare system, is known to everybody, because that's something that can benefit AI systems that want to analyze and help you make good decisions based on that data, but also helps human beings understand what they're getting into before the fact. And I think from an interoperability standpoint, I mean, healthcare, I think we all know, is quite challenging when it comes to proprietary systems trying to interoperate and talk to each other. Ironically, I actually think it's maybe kind of reversed. I think AI itself is a mechanism to create interoperability in a way that doesn't require you to have to build custom interfaces with all these different systems that are out there. Agents, AI agents in particular, are very adept at creating that kind of a connection. So I actually foresee a future not too far from today where the idea of building individual EDI or API style interfaces between systems may actually be a thing of the past. And agents may just kind of do that in an exploratory manner without a lot of definition, because they can go and analyze these systems and pull information from them and structure them in a way that then other systems that historically couldn't talk to them would be able to understand. I think it's a pretty exciting area.
Thanks, Ollie. Another question I see here is, does CH have the ability to use claims data and the AI tool to drive members to the best suggested next step with respect to how they can take advantage of the benefits ecosystem their employer offers and the next best action they could take to optimize their health?
Rohan, maybe I'll let you take this one.
Yeah, I mean, I do think that from what Ali had mentioned as part of his starting, conversation, how we're using AI is kind of embedded throughout our platform. I mean, in the demos today, you saw it in the context of member experience and client experience and how our member advocates. But there's also a lot of work that we can leverage AI for within our ecosystem, ultimately in our platforms. And one of that can be around claims and how we think about certainly adjudication of claims, and then how that affects the member. I would say that to answer the specific question of, best suggested next step, it's a matter of collecting all of the needed pieces of information to tell the full healthcare journey and then present that in a consumable way to a member. And I do feel like AI gives us an opportunity to accelerate how we pull that data in and then how we make it visible. So that's kind of what I think in terms of our opportunities are in that space. But anybody else, feel free to add your thoughts too.
Yeah, I might just add, I mean, we already use machine learning techniques to ingest claims and historical interaction data with members to suggest what they should do through our care navigation program, as well as through our regular member experience. I think to Rohan's point, AI represents an ability to really do that at a very large scale and to ingest not just claims data, which we have control over as the plan administrator, and which is largely structured, so not too difficult to interpret, to extend that to other kinds of data that may be unstructured or maybe that may be in other systems that we don't currently have access to and can't actually interpret in a way that's useful for the member. I think of even things like EHRs that I think these AI capabilities might allow us to leverage more than we currently do, and then paint a more sophisticated picture for the member so that we can guide them to the question, to the next best step, taking into account not just all the things that we see within our four walls, administering the health benefit plan, which is very significant, but it's not everything. But extending that to include data that is actually outside of our four walls that might also be helpful in informing a decision.
I'll just add that we don't want to sleep on the data that we have within our four walls. We not only have the claims data, but we obviously see every single interaction that our members have with our customer support teams, with our digital portals. We really can paint this comprehensive picture about how any given member is accessing care and trying to solve their own problems. And we can then really create these patterns and user journeys to try to drive them to other parts of our own product, our own ecosystem, and beyond. I think the potential there is, really limitless, and our partnerships with our own ecosystem of point solutions and other partners really enables that kind of multiplied impact that we can have on our users.
Kimi, if I can also add, I mean, having worked on, as I said, consumer technology and advertising technology systems at Google and at Yahoo before Collective Health, it's one thing to be able to derive a recommendation, like, for example, what kind of ad should I show a user if they're in my user experience. It's a whole different thing to create an engaging way to suggest that to them. So it's one thing to have the AI analyze all this information and provide a recommendation. It's another to think about, well, what's the best way to present this option to the user? And I think, as you know, as well as anyone, if not better than anyone, we built this personalized recommendation system that has effectively like an advertising capability in the My Collective app and My Collective portal, as well as telephonically, to engage people when that recommendation surfaces. So for example, if our AI intelligence layer surfaces that someone has missed their screening or has missed an important appointment, and we need to sort of engage them to remind them, there is a multitude of ways that we can do that through these personalized recommendations, both, again, electronic within the app as well as within our portal, but also telephonic and even physical. Sometimes we may mail something to someone where we feel it's appropriate, that AI then empowers downstream so that we can actually engage the person and get them to actually do the action that we think is the right thing for them. And then the last thing I will say is that's all well and good, but you need to be able to close the loop with analysis to understand which of these channels, in which contexts, and for which kinds of users or people is the most effective. For someone who's a very digitally literate person, the electronic channel may be the most effective. For people for whom a device may not even be an option, or for whom sort of literacy in the digital realm is not as great, something physical, whether it's mailed or even maybe potentially in person in a workplace, may actually be the best way to engage them. And we analyze all of those data to be able to close the loop to understand which of those channels is the most powerful.
Yeah, Lots of really good, juicy points there, Ollie. I think one thing, which is a bit of a tangent from this conversation about AI, but this idea of, you know, understanding people's literacy is not just digital. I mean, it's something that Collective has to deal with in general in healthcare and finance, and it's something that, especially as we're taking on localization and being able to support multi-language, we're doing so very intentionally. We don't want to just snap on a translation model and just say that we did the thing. We want to deeply understand our customers' needs for, you know, pure healthcare reasons, as well as the digital literacy piece. And that makes us extremely thoughtful about how we deploy this technology and new features so that we stay rooted in meeting what our members really need. Okay. I'm going to pivot us to another question. This one is a bit more kind of generic, but I think about what Collective Health does, but I think we can answer this one quickly of, do you connect with healthcare benefit vendors to monitor the deductibles and out-of-pocket maximums? I think this is touching upon our partner ecosystem a little bit. Ollie, if you want to touch on this one a little bit.
Sure. I mean, what I'll say maybe before talking about the ecosystem is, as the health benefit plan administrator, as the TPA, it's our job to both support the plan design that a benefit plan sponsor designates, as well as to monitor all the accumulators and the deductibles and out-of-pocket maxes and people's progress towards those limits. So we do that internally ourselves as part of administering the plan. As part of doing that, obviously, we monitor people's use of health benefit vendors of all kinds, in-network, out-of-network, digital, non-digital, and those, depending on the plan design, absolutely factor into the calculations that we calculate for deductible and out-of-pocket and other. There's other calculations that can be HRA, HSA calculations, for example, as the health benefit plan administrator. So yes, we manage all of that on behalf of our plan sponsors and the members. And it's all visible, as I think Rohan showed in the demo in the My Collective app and portal.
Great. Let's see. Just another plug for folks to put their questions in the Q&A section for us to get through. Let's tackle this one here. Will you ever consider building your AI models in-house versus using an outside partner like Google?
I can certainly start, and then maybe Ali, I'd love for you to chime in too. I think it takes a lot of work to build kind of the base, I would say, LLMs that exist in the marketplace today. And while we can certainly consider taking on such an endeavor, I think leveraging something that may exist and then layering context on that's specific to the healthcare space and what we do in terms of all the data that we have access to as being a TPA is really the path that, you know, we're have been going down. But Ali, if you want to add, you know, your thoughts based off of that.
It's a great question. I mean, early on, I'd say we contemplated building our own foundational or maybe foundational derivative model based on open source models that were out there. But to your point, Rohan, it's pretty clear that the scale of capital that these large hyperscaled AI companies, you know, be they the Googles of the world or, you know, the Anthropics or the OpenAIs of the world are moving at, makes it just not sensible, I would say, even just economically, to say nothing of just practically or technically, for us to try to compete with the foundational model development that they're doing. That being said, there is a lot of work. That's sort of a generic tool. There's a lot of work that needs to be done, especially within the context of providing service for a health benefit plan user, to make that foundational model specific and reliable and safe enough to be deployed. And that's where we've really leaned in, leveraging some of the frameworks that Google provides and others provide. But we do a lot of work on our end, tuning and crafting the data that goes into training those models, and then putting guardrails around those models so that they can't go, you know, off the rails, so to speak, pardon the pun, when providing an answer. Because it's one thing to provide an erroneous answer or to hallucinate when you're asking, a question maybe about the kind of shirt or sweater that you want to buy. It's an entirely different one when you're trying to help somebody understand what's the best care option, or what's the best drug option, or how much money is left in their HRA, or how much is left on their deductible before the plan starts to pay. You really can't make mistakes. The consequences are just too significant in that kind of a context. So from our perspective, the work that we do to tune those foundational AI models using data as well as input from experts, human experts on our staff, is where we've really chosen to lean in.
Yeah, it feels like the clinical and financial implications of the healthcare industry have to be approached really mindfully. And so, like you said, it feels like setting the right guardrails around that is in everybody's best intentions.
Right, and including the regulatory aspects. I mean, there's I think a question in the Q&A about sort of requirements from the HHS and the OIG. I mean, there's just so much regulatory consideration as a plan sponsor and a plan administrator that you have to take into account. And we absolutely, so we're part of the CMS payer working group now. We were invited to join as part of, a pledge to support the CMS trying to drive like the current access framework and outcomes driven reimbursement. And I absolutely foresee us kind of leaning in more heavily there, and also providing an opinion and a perspective from the private part of the health benefits market, not just the Medicare, Medicaid part of the health benefits market, on behalf of employers, so that HHS and OIG can make informed decisions that will hopefully impact not just Medicare and Medicaid well, but also impact all of us in the private sector who are trying to provide affordable benefits to our workers and their families for the long run.
Thank you both. Let's see if we can maybe squeeze one more question in. So we have one more question in here. I would love to hear more about checking for hallucinations. Any tips other than just double checking against existing data?
I mean, there are a lot of tips I would recommend. First and foremost, I would just say pick the model that makes the most sense for your context. And I know that might sound a little generic and a little bit trite, but it's actually really important. So we take a constellation approach, we call it internally, where we evaluate various models' output against each other for a given set of questions or prompts or contexts. And then depending on what we see during that testing, we focus on a specific model, or maybe a combination of models for the need. And then once you've done that, depending again on how rigid your responses need to be, there are capabilities like RAG, or retrieval augmented generation, where you basically restrict the space of data that the model can draw an answer from based on a prompt. And then we test and we evaluate using that kind of RAG capability, or retrieval augmented generation capability, whether or not these models actually abide by those restrictions, because they're not totally deterministic. They're a little bit probabilistic in their output, which is why they hallucinate, but is also what makes them be able to do things like reason, quote unquote reason, or do things that are kind of non-deterministic and kind of extrapolate, infer, deduce things from things that aren't explicitly stated, which is what makes them powerful and flexible. But it takes a lot of trial and error and a lot of user input to make sure that experience is tuned really well. So I would recommend, as a tip, to try different models. And then if you're going to use something like retrieval augmented generation to restrict the span of data that the model can return a result from, to then test the heck out of that as well, because it's not simply a matter of saying, don't give me an answer from anything other than this set of data or this set of information in a database or a knowledge base, because oftentimes these models will still go off the rails, and you need to tune their response pretty heavily.
Thanks, Sally. Might drop one last tip and then I'm going to close this out, which is I would say do not shy away from your own change management and feeling confident in the output. It may seem tedious and maybe counterintuitive for a human to have to do this QA and checking the sources. But if you really kind of reassess and reflect on what would make me feel comfortable to put AI and release my own control, to have AI do these tasks, I think so often we neglect the human sentiment about AI. And I think even as the builders of AI, it is just as important for us to feel confident in anything that we build and put out into the world. We can't just trust that everyone's doing AI, so this is good, let's push it out. We have to have our own standards. We have to define for ourselves what good is, what accurate is, what quality is. And that's work. And I would say something that not a lot of people think about and run into as a blocker, that slow down deployment, but is just as important and makes you better in general, less even about AI, but as a technologist to really understand how you define your systems and quality output. Okay.
Well said. Well said.
Thanks, Ali. I think that's all the time we have today. We will be sending out a follow-up email with recordings as well as summary of some of these questions and answers. But thank you so much, Ali and Rohan, for your time, and everyone for submitting questions and spending some time with us today. Appreciate everybody.
Thank you all.
Thank you.
All right. Take care, everybody.